Hello and welcome to Module 4, Nursing Terminologies and Classification Systems. The learning outcome associated with this module is to evaluate the impact of nursing terminologies and classification systems on a specific domain of nursing. Now, we will focus on terminologies, classification systems, but we'll also discuss managing our own data and what these classifications, what terms can mean to us as we manage our own data set. Obviously, there's a need for standardized terminology, especially given the amount of data that we have access to, the different ways in which we collect it, the platforms that are used, the software, the systems. We have lots of data coming from different places, different spaces. But in healthcare, that shareable, comparable information is needed. So as you all know, it's difficult, you've heard the saying, difficult to compare apples and oranges. And so with healthcare data, that's certainly true. We really do need to be comparing very closely across. Without these standardized terminologies, inconsistency in reporting and documentation can result. Inefficiencies, errors, these can be found in the local, regional, and national data reporting areas as well. And I know that you all have recently participated in the Module 3 activity, maybe working on it now. But that activity where you're asked to go to different databases, look up different statistics or query those databases, you can probably see pretty quickly that each of those systems, each of those databases have a different way of storing and even sharing that information with those that are using it. So let's talk a little bit more about healthcare data standardization. So you may hear different terms being used to explain this. For example, reference terminology, which is different than a standardized terminology. Reference terminology serves as a resource that represents domain knowledge of interest. This actually facilitates data collection, processing, and aggregation. But those terms, those reference terms, may not be sufficient enough to help with design and structure of documentation forms that nurses use in daily practice. So we refer to interface terminology as a collection of task-oriented terms that are used to support data entry. And these are probably the terms that you would see in an EHR system. Now, terminologies are often called classifications. And when these concepts or expressions are organized according to their conceptual similarities rather than their semantic meaning or resemblances. So, for example, chest pain and growing pains are semantically close in that they're both considered a type of pain, and they could be classified or categorized rather as a finding or some type of data related to the sensory nervous system, or they could be classified by the location of pain. So where on the body is this person experiencing the pain? So those are sort of, that's another example of how things are classified. A concept refers to a class in ontology. And so this image here is actually borrowed from another textbook that I used in a different course, but I thought it was a pretty good illustration. But this is where the meaning of a concept is formally specified using properties and its relationships with other concepts through inheritance. So this sort of gives us an example, a breakdown of how something might be classified in an ontology. or a concept is classified in ontology. Now, just to give you sort of an example here of why we need standardized terminology. So I just did a little search online using the online images that can be downloaded without any copyright issues, just looking for terminologies. And I ran into different sports diagrams here of different fields, or in one case we have an ice rink on the right, on the left there's a football field. So you can imagine that if someone was in the process of collecting data, they might be collecting something related to points, they might be collecting something related to yards. I know in hockey you don't necessarily have yards, but some other type of metric. But without knowing the context, without knowing the classifications that are surrounding this, then it is not very clear. And so it's very difficult to figure out what to do with that data in the end. Same thing with, this is another example, a horse and a dog. Some of the parts may be identified, may be the same, but those are obviously two different species. So it's very important when we're designing user interface in informatics. So, what the end user is seeing, how that data that's being collected is communicating with another system in the larger system. It's very important that we have standardization, that we have this quality of terminologies. This will only support the data retrieval and exchange that occurs with the data that's collected. This also certainly helps us as we monitor the quality of care over time, and then ultimately also looking at the knowledge that we can discover through that, through research in the form of data mining, data discovery. So in thinking about this, we need to certainly consider the significance of this as it relates to our the care that we're able to provide, or we are providing to our patients, how we summarize data, the mining that occurs, the knowledge management and decision support that continues to evolve, the linking of professional vocabulary and consumer vocabulary, because we talk a lot now about not only the collaborative interprofessional relationships, but also health literacy. So how are we communicating with patients? How are they interpreting and learning from what we teach them, what we share with them? And then also this is important for clinical translation and comparative effectiveness research. So as we think about data and how we are managing it, this again is another image that was borrowed from a textbook that I use in a different course, but it sort of outlines pretty clearly the steps of knowledge discovery and data mining in that process. So obviously it starts with the retrieval of data that can be used for analysis. Then there's this pre-processing of the clinical data, the sampling and partitioning, so determining what is it that you are going to look at, what parts of this data set are relevant to you, mining that, and then evaluating data mining models. So in terms of data management, we know that it's really important to plan thoughtfully. So hopefully through this activity, through the readings in this module, you'll learn a little bit more about this, and then certainly when you get into other courses, you will begin to actually apply some of these concepts. But preparing for your data collection is of the utmost importance. In developing the analysis plan, you'll work with someone who's quantitatively gifted, hopefully, if you're using quantitative data, and then likewise qualitatively gifted if you're using qualitative data. You'll also need to consider, how are you going to keep this data safe? Is the data that you are extracting, whether it be from a secondary source or if you're collecting it yourself, how is it going to be stored? How is it going to be protected? How are the individuals going to be protected, etc.? You'll want to create the data set that you're going to actually analyze. You'll explore the data set or sets, and then ultimately report the results. Now for this module and the activity, the assignment that we'll be talking about is really specifically related to creating the data set to analyze and getting a little bit more familiar with that. So you probably heard the term cleaning the data. So that's kind of what we're going to talk about a bit. Shaping up the data is another term that people use to describe this process. Now in your module, before we get too far into this, we need to consider the levels of data. So we talked a little bit about this before. You know, data is considered the nominal, ordinal, interval, or ratio level. I have a very concise little table there in the module. I did kind of spell this out here in these next couple of tables for you. But this is how each of these are defined. You probably remember this from a class maybe that you had in a graduate course at some point. Here are some examples of those levels of data, and then the descriptive statistics that you might apply to those particular levels of data. Now just a little humor here for you. I don't know if you all have heard of PhD Comics, but I would certainly recommend you visit that whenever you have free time. Just kind of helps to sometimes laugh and chuckle, I guess, at some of the things that we experience. But this is true, and we talked a little bit about this. You know, you work really, really hard to either collect data, interpret it, try to disseminate it in some way, and then in many, many cases you have very little time to describe what you've done in that large amount of time. So, and that's kind of what you're doing with your videos that you're preparing, because you only have 5 minutes to do those. And this is just kind of a good reminder that this is pretty much how it goes. We prepare for a really, really long time, and then sometimes we only have a minute or two to share what we've done. So I'm going to go through a little example for you just to sort of illustrate this notion of managing our data, considering the levels of data, and considering the terms that we're using. So let's talk about pain again. That was an example earlier. If you, and I know some of you are very familiar with this pain rating scale, because I know some of you have done worked in pediatrics. So the Wong-Baker-Faces pain rating scale looks like this. And you know, typically when you go into an ER environment, you go to a doctor, if you have pain, they're going to ask you on a scale of 1 to 10. Well, you know, a young person can certainly identify a bit more with some of these expressions. But what if your pain scale, if you will, is this visual analog scale? How will that look on your on the data side of what you're doing? Or this is a McGill pain index chart, which physicians might use to measure and compare pain. And so that's a different perspective, most certainly, than from the patient, but also it's different in terms of what the data would look like. Another one is the color pain scale. So how would this be marked? How would someone report this? And what's that going to look like if you were collecting the data? Another would be like a patient. This is an example of a patient-developed pain scale. And so, what would this look like for you on the side of your data collection? Another example, color-coded numerical pain scale. Another example is a personalized pain scale that a patient has actually developed. And then this is a Randall chronic pain scale, and you can see they actually ask you to give a word that describe what this level means. So they pick a level that they're at, and then they also describe, and then they want them to give examples of what causes this. So you have, in this case, you have quantitative and qualitative data. So this is a pretty simple example, and before I move on, I must declare that I do not know anything about the reliability and validity of some of these scales. I'm certainly familiar with the one that we use with kids. I've seen this visual analog scale a time or two in research, and then the 1 to 10. But these other things, I'm not a pain expert, so I'm not sure. But nevertheless, in the this is a pretty simple example here to show you that there are different ways in which we collect data on the same concept. There are different perspectives, different levels of data that may evolve. So just be considering all of this when you begin to design your study. And a lot of times we're limited certainly to what's available to us. If there are certain measures that already exist, or if we're going into a certain environment and we can only collect certain type of data. But this was just sort of an example for you so you can see and consider, again, just the way in which the data might come back into your file and into your study. So one of the things that we're going to talk about as we move forward in regard to data collection and data management is a code book. So this is an example code book that I actually just scanned this in. This is from some of my notes from my PhD program. We had a very large, I guess I would call it intense rather, data management class that we had to go through, data management analysis. And so we were given example code book. So this is one that somebody, you can tell they just typed it up. They put what the variable name is and their definition over here. And that's essentially simply what it is. Here's another example. This one's a little more involved. There's values, code. You could even document what level of data that variable is, and when you move to SPSS or some other type of statistical software, you will be doing that because that's essential to how that program is going to help you calculate your statistics. So let's move to the course and see if we can kind of go through a couple of things for you, hopefully to help clarify. So, we will not be discussing statistical procedures in this course. This is more of the concept of managing your data. We will do this activity that where you're going to go through some technical things here with spreadsheets and hopefully become a little more familiar if you're not, a little more comfortable if you're not already. And consider, once again, just consider what you might be working with. These are the types of variables, again, same information that was shared in the PowerPoints. These are your reading assignments. Appendix A in your textbook is a classification overview. It's the overview of the clinical care classification system. which was put together by one of the editors of this textbook. And you, of course, have your PowerPoints from the textbook, from the authors that are shared with you, as well as a number of articles and links. Now, I would tell you that some of these things are just very helpful. Hopefully all of them are, but I know you may not have time to read in-depthly all of these, but certainly scan through them, and I hope you find them helpful in further explaining this, as well as hold on just one second, I'm sorry. There we go. Yeah, further explaining and clarifying for you. Now, one of these is a video, which is pretty interesting. Who owns your data? It's just a little over 5 minutes, but it's pretty interesting to consider that content as well. And there are a couple of websites here. One is the NINR, the National Institute of Nursing Research, what they consider to be data science. They do a lot of work in this area. Every year they have a big data boot camp that people can attend. It's a very, very limited amount of people that can attend this, so you have to sign up pretty early on. And I attended a couple years ago, and the topic was on genomics. It's fascinating, and just pioneers in a lot of ways in these areas. But they often post their lectures on YouTube, and they have just some very interesting, very helpful information that you might find interesting as well as you're preparing to do your research. So take a look at those. I will share with you the assignment. I'll go over that a little bit, and I'm actually going to do an example for you in Excel, because this this work is to be done in Excel. And I know we all have varying degrees of fluency with different software applications. So I'll do a few of these with you here. So you're going to use this particular data set that is linked out in your module in the assignment information. So this is the data set that you'll be using. Here's some information that will help you with your code book, help you define that. So let's go ahead and take a look at, pardon me, just some of the directions here at the beginning. You're going to use Excel, of course. You're going to open up that data set in Excel. You're going to create several worksheets within the file. You're going to figure out, just do some very basic calculations. What's the average age? What's the distribution male, female, that type of thing. You're going to do some formulas, very few, but just to sort of get your feet wet, or sort of remind people if you haven't done those in a while. And then there are some tips that are here too about setting up your files and in your code book. There's also a rubric down here for you as well. So let's go ahead and I will do my best here. So you can either, you can do what you wish. You can actually transcribe this data, and keep in mind that in some cases, depending on how you are collecting your data, where your data is coming from, you may actually be working with pen and paper. There's no telling. But a lot of what we do now is electronic, or we have some type of way to collect the data, a survey, etc. Now, this is a very small data set, and I will also declare that this all of this data was made up by me. So please do not think it's realistic completely, especially with these blood pressures and weights and heights and things like that. So you can copy this and open up a new spreadsheet. Get rid of that. Get rid of this one. Okay. So you can simply paste it in there, and you have the first thing we're going to do is rename this raw data. Okay. Then you hit that little plus button down there at the bottom, rename, modified data. And you can use no spaces or spaces, however you want to do this. This is your data. So we're going to take the same data set. So consider this too while you're thinking about this. You know, some of you may use online survey tools to collect data. That data comes in, it doesn't look near this nice. There's a lot of cleaning that you have to do typically with those data sets. Now, a lot of them will do some fancy things for you, and they'll analyze from the program. I wouldn't trust it. I would certainly validate it by all means in some sort of statistical software or you know, Excel. So let's go ahead and do a few things here with your modified data. First of all, you can see how we have a little issue here. We need to merge cells. Sometimes that happens. And it looks like it's this one. So we can click on it and then hit Control all the way across. So I'm just holding the Control button down and clicking on these, and then I'm going to merge and center. So I got rid of that yucky stuff right there. So now I got this in inches, in inches. So if I want to make sure I keep that in my variable column, or title rather, go ahead and do that. So right click on this row, delete it, and then we have the row height. I don't like that. Let's see, row height, I go 12. There you go. And looks like we have another little issue down here. So I'm thinking maybe that's it. Not sure. Do the same thing. Control and merge. Okay, yeah. I'm not sure where it went, but what was causing it, but it's out of there now. Perfect. All right, so you see that helps clarify things. Now you can get rid of all these little borders. You don't have to do all this. This is not necessarily what I'm looking for. I'm just trying to help you all see how you might begin to look at this data. So, or get it cleaner than it was. And again, this is a very easy data set to work with, obviously, and it's complete. You don't have any missing data. You don't have anything that's going to throw you off. So one of the things that you have to do is do an average of the age. So I'm going to do an average of the weight just to show you though. So you can just come down here at the bottom of that column, AVG, average, grab all of that. Oops, okay, and there we go. That's our average. Now you want to format the cells to watch the decimal places there, and we just put it down to 2 decimal places. Okay. Let's see here. Let's look at something else you might have to do. Now you can look at the distribution of males and females quite simply. Now you can do pivot tables. You can do, fancier things. I'm not asking you to do that in this assignment. If you'd like to do that, feel free. Pivot tables can be very useful when we're looking at counts of something. So in this case, gender or marital status. I'll look at, I think yours asked for gender. I'm going to look at the marital status just to show you. So I'll certainly use the sort feature a lot, and I want to sort by marital status. And there you go. So we have 3 divorced, 12 married, 4 single, 1 unknown, and 8 widowed. So that's one way you can find it. Now you can collect that data. You can write it somewhere in here. Now, in this case, again, I'm just doing an example. I think your assignment asks you for gender, but you can do this however you want. You can put it on another sheet. You can put it on this sheet. It does not matter to me, but you just might want to highlight it so I can see it pretty easily. Then, let's see, let's do another, and we can go back. That's resort or unsort our data. So let's try a formula where we're looking at. You might want to adjust your row height here so you can see these variables, and you might want to center these. You can bold them. You can do just whatever helps you to see this information. Okay. Next, we can add we're going to do a difference in the baseline and discharge systolic blood pressure. So we're going to insert a column. And, I get a little confused sometimes. You can rearrange the data if you want. So you can move this over here and just look at your baseline, your blood pressures. You can have them all together. I like to do a lot of color coding. It helps me see the data. So in this case, so I'm going to do the diastolic in yellow, and I'll do this in maybe green. I'm sorry, I messed that up. Systolic is green and diastolic is yellow. Okay, all right. So now let's just do a let's see, difference in, and I'll just abbreviate difference systolic BP. Okay, so we're going to do a formula, quite simple. Put your equal sign in there. You're going to want to do your discharge blood pressure, systolic blood pressure, minus, subtract the baseline systolic, and so it's up a point, and we see that to be true. And we're just going to copy that formula, and I bet there's going to be some negatives. I hope there's some negatives. Yes. Okay. So that would be our formula column. Okay. So you'll do that also with your diastolic, and you'll also do some formulas with determining which diagnosis, like how many were diagnosed with this certain diagnoses, and that information, the information to sort of help you decode that, if you will, is right down here on your data set. You have these codes, ICD codes, and what those mean, so you can sort of start to, again, organize this. So this is really, it's up to you how you want to organize this, how you want to manipulate it a bit. In the end, it should be clear, it should be neat, it should be fairly uniform, I guess, in terms of what we're looking at. And then it's visible, and then the answers to the questions that are provided there in the activity, again, you can put those in this sheet, wherever you want, and you'll also add your data dictionary. So you'll add your, just like you saw in those examples, you'll add the variable and definition and the column, okay? So you'll just go through there, and once you have everything organized the way you want it to, where you want it to be, so this was patient number, and then you have, what's the next thing? Group, okay? So in this data set, we're going to consider that this may have been like a research study. So those that were a 0, they have a 0 in this column here. To the second one to the left, they had no exercise. If they had a 1, they did an experimental exercise program. 2 was exercise encouraged and logged. So you can look at that. This is another thing that you'll have to code: the race, the weight in pounds, height in inches, the ICD code definitions, the average length of stay. That information should help you along with this data set to answer those questions. Now, please keep in mind that if you have any questions whatsoever, because I know this is a technical type of activity, and the goal is just to get you, very familiar, very comfortable in manipulating and using Excel. Now, what I'm going to do is I'm going to show you also what this would look like. And please don't mind my desktop. It's a little messy. Test M4 desktop. So if we were to pull this up in Excel, SPSS, what it would look like. Because in the end, again, you're more than likely going to be using some sort of statistical package to do further analysis. What we can do some statistics in Excel, but it's much easier to manipulate and kind of transform, move things around, and analyze in something like SPSS. So if we want to, but you can manipulate your data, clean it up really nicely in Excel, and then open it in SPSS. You're going to want to look for all Excel files. We have test, it was called test M4, here we go. Okay, there you go. So it's going to look a little like this. There you go. And then you actually have, this is sort of your code book in Excel. You can add information about the label, the name, what type it is, if there's any decimal points that you're wanting to constrain on it, measure if it's scale, nominal, whatever the case might be, and then you can begin working on your analysis. So I just wanted to show you that as an example of what you can do. Of course, again, with this assignment, I'm looking for you to begin to organize this, put those formulas in there, do some simple data management, apply some simple data management techniques to this so that you can begin to feel more comfortable. If you have any questions whatsoever, please do not hesitate to contact me. I'm happy to help you. And then just one last thing, this is why my desktop and my files look this way, because I saved them so many times. It's very, very important to keep saving your file. I often save it as I keep adding to it. I keep adding more data to it. I save it as V2, V3, V4, whatever the file name is, and that helps me. Some people organize by date. Some people organize by, just different things. But I would encourage you to come up with some sort of system for yourself that is reliable and consistent, so that you don't have any trouble finding the files that you need and in the way that you need to find them. So again, I would encourage you all to explore a bit, and again, feel free to contact me with any questions.